Okay, so moving on to the posterior and the sides, I also am going to listen to the trachea. So again, back here, what I'm doing is I'm mainly just feeling that there's no tender areas. In addition, making sure I'm not feeling any nodules, any types of anything that's been bothering you at all. Really just making sure that everything is consistent on both sides. Now, if you bend your head forward for me, I'm actually going to feel his spine going all the way down. You want to feel each vertebrae individually, and you can actually feel those pretty well. But that also helps in the assessment. Okay, and so now what I want you to do is, if I could just get you to take a deep breath, I'm going to center my lungs here and just make sure that everything's even. Go ahead. All right, and one more. Okay, and that actually pulls the same distance. It shows you that the lung capacity and all of that is even. So for this part, what I'm actually going to do is just go ahead and percuss all the way down the lungs. And you can actually hear where it starts to change. So for him, I'm actually going to mark that so then I can measure that. Oops. All right, and now can you take a deep breath for me and hold it? Okay. And so with that, I can actually measure the difference here, which a normal is 3 to 5 centimeters, which he does fall in. For someone with emphysema, it wouldn't be abnormal for that to be off, just because sometimes their lung capacity could be not as great, depending on how bad the emphysema is. And that's actually the same for both sides. Again, you can hear the difference there. I'm going to go ahead and auscultate, or I'm going to listen to your breath sounds. But first, I'm actually just going to stick this up here and listen on your trachea. Can you say 99?
99. 99.
Okay. And then back here, can you take just a deep breath for me? Okay. Okay, and then again on the sides here. Okay, and so for him, I'm not actually hearing any crackles or wheezing, which in a normal emphysema patient you may start to hear. However, also to just do more fluent, like a more fluent or in-depth assessment, I could easily have him auscultate every single lung field again while he's saying 99, while he's whispering 1, 2, 3, also while he's saying E. It kind of just changes how you're hearing everything throughout his lungs, and it's just really confirming, all of his lung fields and the normalcies versus abnormalities that you would hear in this specific patient. Now, for him, all of his lung sounds are sounding good. Again, as I said before, I would follow up on a lower body assessment, checking the pulses, checking his skin, making sure that there was still the hair growth there, so you could really see all of anything that would have to do with the cardiac functions, making sure that he's getting enough oxygen. All of that would be involved. Now, remember that I would have taken the vital signs earlier, so you check his respiratory rate. For him, you would want to do for a full minute, check his O2, just understanding the normalcies versus the abnormalities. Because we've already had a previous health history for him, he didn't have any problems during the assessment, I can actually assume that everything is functioning quite well, and I was able to get a better picture of how Mr. Blay is doing. And thank you, Daniel, for your help.